welcome to the Cosi Talks channel. So the question I'm going to answer for you today is one that I hear a lot from my patients and also from my viewers, and it's regarding the changes in the shape of the residual limb. So right after your amputation, you can probably remember that your residual limb was pretty swollen. It had a lot of edema, a lot of swelling, inflammation in there from the actual surgery itself. That particular swelling from surgery can take from 9 up to 12 months to resolve itself. And during that first 9 to 12 months after your amputation, your leg is undergoing a lot of changes, especially when you start first wearing your prosthesis and you start using your socket on a more day-to-day routine. After those 9 to 12 months, most people will see a plateau. Their residual limb will achieve an almost final shape, but you'll still start to see changes, especially the more active that you become. Some amputees, after those first 12 months, their limb will stay the same, and they just manage it on a day-to-day with a couple of ply of socks. Other amputees can experience changes in the shape of their residual limb for up to 10, 20 years after their amputation. The reason for this is because our bodies are dynamic. They are constantly changing, even for those of us who've never had an amputation. Our bodies change with age, they change with weight, they change with disease processes. So for some of you who are experiencing these changes even years out, this is part of maybe your normal status. There is one thing I would want you to take a look at. Take a look at your medical history. If you lost your limb due to diabetes, hypertension, cardiac issues, lung issues even, autoimmune disease, a lot of these disease processes that are still active in your body could be causing your limb to swell and shrink on certain days. This is why it's very, very important that you have a close communication with your doctor regarding your medical status and keeping it under control. Whether it's controlling your glucose for your diabetes or keeping your blood pressure under control with the right medication, the more stable your health is, the more stable your residual limb will be. So, just to kind of recap, there's post-op swelling in your limb that can last 9 to 12 months, and then there's the different changes in your limb that can occur for years later. That's all I have for now. If you enjoyed the information or you got something out of the information that I was able to give you, give me a thumbs up and subscribe to this channel. You can also sign up for my email subscription at www.cositalks.com. And don't forget, you can ask me your questions live every Wednesday night at 8:30 p.m. Eastern Standard Time on the Cosi Talks Facebook page. All that information is listed down below. All right, folks, have a great day. Ciao.